You see?
God! Just try and relax, Mrs. Lowry. I'll make you 20 years younger.
Oh my gosh, she has got a chip clip holding her face back. It works though. There's a lot of plastic surgery in movies, and not all of it is at all realistic. So let's watch some plastic surgery scenes from our favorite movies and react to them. Starting out, it looks like the two characters, Nicolas Cage and John Travolta's characters, are under a general anesthesia. They're completely asleep. But to put somebody under a general anesthesia, you need to put an endotracheal tube down their throat. And this is a tube that allows air to go from the ventilator into the person's lungs. So starting out, this is not realistic at all. This is not where I would make the markings if I was going to do a face transplant. The markings that they're making are in the skin, and they're totally going to leave visible scars if they do the surgery this way. These scars are so not hidden, and a good plastic surgeon would catch this right away. Who cuts with cautery? There are many studies that show that if you burn the skin, like using a cautery, when you cut it, it creates a much worse scar than if you use a scalpel. So use a scalpel to cut the skin, not cautery. I mean, this is dumb. Who is the medical advisor for this movie? Because that person should have been fired a long time ago. Okay, so taking a person's face off is not this simple. It's not as simple as just cutting the skin around it and then suction cupping their face off. In order to do a true face transplant, we have to cut the nerves and the blood vessels very carefully that lead to different parts of the face. Then when the donor face is transplanted into the recipient's face, you have to resuture those nerves and those blood vessels back together. It is not as simple as just suction cupping somebody's face off and then putting it on somebody else's face. Although it would be a lot easier that way. When we transplant organs from one person to another, typically those organs are put under ice. And one way we do this is we literally take an igloo cooler, fill it up with ice, and then put the body part in a plastic bag, a sterile one, and put that on the ice. Now, I don't know what type of clear goo this face is swimming around in, but that is not how we normally do this. Why is he massaging this face? Now, if you do a proper face transplant, once again, you have sutured these small blood vessels back together. If some nincompoop comes and starts massaging the face, they're going to tear all of these connections, and you got to start all over again. What an idiot! Where are his scars? My God, this is stupid. Where are we? In Dr. Ricky Brown's office?
Let's see how we did.
Seriously, if your doctor is performing a cosmetic procedure on you in a setting like this, you have to run away. Now, believe it or not, people do get cosmetic procedures and even surgery in crazy locations like what you're seeing in this movie. I have heard and seen of people undergoing surgeries where there are literally flies buzzing around the room when they're having it done. There are bloody rags on the floor from previous patients.
For jacked up black market prices.
And they've even have like restaurant condiment type things like old ketchup bottles that they use in place of actual medical equipment. It can be very, very scary. Now, when I do cosmetic surgery, and I do it 3 days a week, and I have been for the last 18 years, typically I have the patients remove their initial bandages 2 days after surgery. And God forbid, I hope that they don't rip them off like this guy is doing here. That they do it very gently and very carefully. I have actually never seen a patient develop a problem with how they remove their bandages before, but I probably have not had a patient like this guy before. Are you like the millions of people who have a bathroom filled with half-empty bottles and tubes of skincare? They may have promised to reduce your wrinkles, lighten your blemishes, and help you feel better about your skin, but none of them actually worked. Well, I've got the answer for you. It's called Youn Beauty. Youn Beauty is one of the only skincare lines that combines natural and organic ingredients with the latest in scientifically proven components like vitamin C and retinol. I'm so certain that you'll love Youn Beauty products that we offer a 30-day money-back guarantee, no questions asked. Head to younbeauty.com and use the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below. Once you try Youn Beauty products, I bet you'll throw away your other skincare products and start loving your skin again. Thank you for putting your trust in me.
Mirror!
Now this reminds me of when I was a plastic surgeon in Beverly Hills, California, and we had a lot of patients who would undergo facial plastic surgery, then they would wake up from anesthesia and ask for a mirror so they can see their results right away. I don't see this nearly as much in my practice in Michigan, but this is actually not that unrealistic.
You see what I have to work with here.
Okay, so let's put up a snapshot of this doctor, this plastic surgeon's instruments, and let's go over exactly what he used to create the Joker. Now the big thing on the left almost looks like a breast dissector, like this. And this is a blunt device used to literally tear open a breast pocket to put an implant in. I don't know why this is on his tray. Unless the Joker was going to get breast implants, it doesn't make sense to try to use this on somebody's face. Next, you have a bandage scissor, which we use in the clinic all the time. Next to that, you've got some weird type of mallet or something. This is not a device I myself have ever seen, so I have no idea what it's used for. Now the instrument at the top of the tray looks like a ladle that I would use when I'm making spaghetti to pull the noodles out of the pot. Once again, what you do with that in somebody's face is beyond me. In the center of the tray, you actually have a long surgical scissor and a forceps that do look like real surgical instruments that can be used in a person's face. Next to that is a topper that you would put on a wine bottle. Then you've got a surgical clamp and a random piece of plastic. So putting it all together, it makes a lot of sense why the Joker looks the way that he does.
My friend, you can call me Joker. And as you can see, I'm a lot happier.
Now this always reminds me of a corner mouth lift. And this is an operation that I do perform here and there where we cut out a triangle of skin from the corner of the mouth. This lifts the corners of the mouth, essentially turning a frown upside down. Now why this reminds me of the Joker is that after this procedure you typically have a scar coming up from each corner of the mouth, resembling a Joker smile.
Let's put a smile on that face.
And when I do this operation, I always tell patients, you're going to initially look like the Joker, but don't worry, it all settles down and you're going to look great in the end.
Daddy! I'm so happy you could be here.
How are you, baby?
Did you bring any Botox?
I didn't bring a Botox. I brought my cousin Eddie.
Nice to meet you, Eddie.
Is this a Halloween party?
Okay, I hate to say this, but it has to be said. he looks kind of like Wayne Newton. Now, Wayne is a fantastic singer, but he is just not a great example of plastic surgery. Now, I'm not Wayne's doctor, so I don't know exactly what he's had done or whether he's actually had plastic surgery, but come on. Wayne Newton, take a look. You must agree.
So, do you have any feeling in your face?
Just in this one spot right here. And then from the eyebrows down, dead.
All right, let's put a picture of Kevin Nealon's character on the screen up here, and let's figure out what procedures he may have had done. So from the top to the bottom, it looks like he's had a hair transplant because his hair is so full. On top of that, I think he's had a brow lift. And a brow lift can create a very unnatural looking hairline at the front of the scalp. And this is because there's a scar that's placed right there. He looks like he's had some Botox to his forehead. He looks like he's had his upper eyelids done or an upper blepharoplasty. He may have also had a nose job. I think he's had a facelift. I think he's had some filler into his cheeks, and he's probably had full face CO2 laser, or basically a resurfacing laser over all of his face, causing his skin to look somewhat tight and even waxy looking.
I wanted to go to your cousin Danny here, but he refused to do any work. He didn't want to put his fingers in the pie.
Ooh, it's getting dangerous, this amount. You gotta slow it down. Okay, see that?
If you have a bunch of Botox injected around your mouth, it can cause the muscles of the mouth and the lips not to work normally. And it is not unrealistic to think that somebody might drool a little bit after drinking out of a glass if it's overdone.
Sam, it's time for you to grow up and accept responsibility. Your poor father would be appalled at your lack of promotion.
What the hell is going on here?
You haven't got the ambition.
Don't get upset. Mr. Lowry, please wait in reception. You're giving her wrinkles.
You see?
God. Just try and relax, Mrs. Lowry. I'll make you 20 years younger.
Oh my gosh, she has got a chip clip holding her face back. It works though.
We remove the excess derma. So, now the flaccid tissues under the eyes, and forehead. See?
This is not where I would make her incisions. He's got markings in the middle of her forehead, on her cheeks. The scars, the incisions have to be hidden. This guy is not a real plastic surgeon. He's a charlatan.
Now the template. And now a bit of sticky. So. And already she's twice as beautiful as she was before. Voila.
I need to stop watching TV. These are some pretty out there scenarios, but sometimes real life is stranger than fiction. Take the example of a real life man who's trying to transform himself into a Ken doll, for God's sakes. He's had a ton of plastic surgery, he shows no signs of stopping, and I react to his story from my strange addiction on the video right up here. It will astound you what he's planning to do. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.